NCCI recently surveyed senior insurance executives at over 100 carriers across the country. These leaders agreed that costs and uncertainty surrounding healthcare is a top challenge for workers' compensation. Uncertainty is a common theme as Americans wonder about the future of the Affordable Care Act, as well as the long-term potential for universal healthcare legislation introduced this past year. As the name implies, the Medicare for All Act of 2017 proposes expanding the current Medicare system to become a federal insurance program for all. What is the potential impact for workers' compensation? The legislation requires workers' compensation carriers to reimburse the Universal Coverage Plan for medical benefits provided for work-related injuries. However, the potential impacts of this legislation are not yet fully known. At the state level, several states have considered creating single-payer healthcare systems. In 2011, Vermont passed a law to set up a single-payer system which required the state to evaluate incorporating workers' comp. After studying the issue, the state recommended that workers' compensation should not be integrated, and the single-payer system was ultimately never implemented. In Colorado, voters overwhelmingly defeated a ballot measure to create Colorado Care, a single-payer healthcare system, in 2016. And in California, the Senate passed legislation this session to create a single-payer system. The bill is still pending before the state's assembly. In addition, several other states are looking at single-payer legislation in 2018. While single-payer has been discussed recently at the state and federal level, the idea is not new. Going back to the 1990s, several states had pilot programs to implement 24-hour coverage, none of which are in place today. Why? And what are some of the potential concerns or questions for workers' comp? Let's explore a few of the issues. Unbundling indemnity and medical coverage. If medical is removed from workers' comp, how do carriers manage medical care and ensure that workers return to work as quickly as possible? Worker safety. Are there potential safe workplace impacts if experience rating and safety credit programs are no longer in place for employers? Subrogation and exclusive remedy. Who can recover healthcare costs from a third party relating to the injury or illness, the insurer, or the single-payer system? Will exclusive remedy protections for employers remain in place? Choice of treating physician and medical treatment. Under work comp, injured workers receive treatment from accredited physicians who use treatment guidelines developed for occupational medicine. If these requirements are eliminated, could it increase costs and lengthen return to work time? Reducing employers' workers' comp costs. Would carrier expenses decrease by the same percentage as medical costs? Or would other factors and costs come into play? Even if it seems unlikely that the Medicare for All bill will become the law of the land, it's important to look at the possible implications and keep an eye on states proposing single-payer legislation and ballot measures in the coming years. NCCI continuously monitors developments at the state and federal level and conducts research about healthcare cost drivers.